All right. Well, welcome everyone. Hopefully we'll have a few more folks that will continue to join us, but want to go ahead and get started so that we can cover as much information as possible this evening. Let me introduce myself. I'm Lynne Kinst. I'm the Executive Director of the Hemophilia Council of California, and we want to welcome you to our webinar this evening on collaboration as it relates to healthcare access. So thank you so much for joining us. We have a couple of quick announcements. We want to thank our sponsors who helped to make this evening possible. We are an organization that serves patients with bleeding disorders throughout the state of California. And we also work with a lot of other rare disease and chronic disease partners, which is part of what we're going to be talking about tonight. And our whole goal is to really ensure that patients across the rare disease community have access to quality healthcare and the treatment and the resources that they need in order to move forward. So with that, I would like to introduce the special guest that's joined us this evening. Adrienne is a fourth-generation patient advocate providing leadership and support in the sickle cell community. And she and I have become acquainted through a variety of opportunities. We served together on the California Chronic Care Coalition Board of Directors and are just regularly advocating on the same issues and policies. And so thought Adrienne would be a great partner to talk to with tonight about this topic of collaboration, both in a corporate organizational sense, as well as at an individual patient level, how we work together with others to really in order to advance our own care and treatment. So Adrienne, I've shared just a tiny little bit about you, but I'd love for you to introduce yourself and share a little bit more with the group about just how you came to be a patient advocate.
Okay, so hi, Lynn knows this. I'm not so good at talking about myself, but I am very, very passionate about patient advocacy. So you'll get a little bit of mix of both. So I have come from a family for generations and generations who've had children living with sickle cell disease. And with my daughter, the only hope we had, because of many complications for her, was gene and cell therapy. And so once we got to that point where I could see, okay, it's going to be real, it's going to happen, I thought, okay, to get my kid saved, my family saved, I'm going to start advocating, right, for gene and cell therapy. I'm going to go to all the meetings. I'm going to learn a lot. And that first meeting, I met a lot of other mothers. And one mother in particular stood up and told the story of how her family had Huntington's disease. And she had buried her husband and one child. The second child was now sick. And the third child, her last child, had just started showing symptoms. And so I thought, oh my God, here this woman is standing up and telling this story. And my heart was just there. And I realized even at that point, I think that we all had to be together in this journey, that healthcare, that genetic diseases, rare diseases, that we all really were one. And this whole concept of trying to make things happen coming from individual voices, individual diseases, was really not the way to accelerate it, and that we all had to work together. And that's really what I think created my vision for what advocacy work looks like in this space.
That is amazing. And I think just from that little introduction, people can see why there is such a great opportunity for the bleeding disorders and the sickle cell communities in particular to really align ourselves and partner with one another, because while while there are always differences, right, in our experiences and the things that we face individually, we have some of the same treaters. You know, there are treaters in the hematology space that treat both bleeding disorders and sickle cell patients in some cases, not in all cases. And then we're both kind of on this journey where we're kind of at the tip of the spear with these cell and gene therapies that are coming to be approved by the FDA. We have 3 approved therapies in hemophilia A and B right now, and sickle cell has recently had some therapies approved, and patients just starting to be commercially dosed with those therapies. And so we're kind of in this together as everyone figures out like what is this new landscape of healthcare going to look like, with kind of a different delivery system, different kind of cost parameters. And so it's a great opportunity to work together on those issues to ensure that patients have access. So that kind of brings me to something that I wanted to comment briefly on. And then I don't necessarily want to spend too much time on this, because I do want to talk a little bit about, on a more individual level, how do you collaborate with providers and other members of the community to really see that your needs as a patient, or your family member's needs as a caregiver, are being taken care of. But we have embarked on a new, more formal collaboration this year, creating the California Rare Disease Access Coalition. And just recently, we invited Adrienne to be on the steering committee of that organization. Along with, we have a partner from the Cystic Fibrosis Research Institute, Siri V, who has popped on some other webinars for us in the past, as well as the California Biotechnologies Foundation and the California Life Sciences Association, to really kind of advance rare disease. So I think that there's been a couple of issues that we've been working on a lot together, things like the all co-pays counts legislation, as well as the Rare Disease Advisory Council, that a lot of us have been fighting for already. And this isn't something to really take the place of those things, but, to create additional and new opportunities to collaborate and kind of hopefully work together to get those things passed. So did you have any thoughts about that and what the benefits of that are?
Well, I'm just going to put in little bit of history. So long ago, the sickle cell community, the hemophilia community, and the thalassemia community, and cystic fibrosis, when these diseases were considered childhood diseases back then, we were all working together then. And it wasn't until the prevalence of AIDS that we sort of all got splintered, right? And so in coming back from that, right, after we've come back and looking at what happened when we splintered, we saw that some groups made real advances and other groups were left behind. And I think that we can't forget, sorry, that's my puppy. we can't forget that lesson, first of all. Secondly, I came from software, and you learn from what works, what doesn't work. And one of the things you learn is, if you find something that works, right, that's really good, you duplicate it, right? You don't relearn it. You don't have to do it a different way. You can make it more efficient, but you duplicate it, and you don't duplicate it in that sense. You reuse it. And so nobody expected gene and cell therapy to go as fast as it did. I did. No, anyway, so that's my happy dance. I'm sorry. But it's gonna go fast. And so we cannot, as people waiting for these things, we cannot wait for everybody to learn the same things. We have to take what the groups that are in advance at that point of that sphere, right? We have to share it. We have to document it. We have to refine it and make it even better, right? And that will accelerate what's to come. And another part of that is if we don't do that, right, we're going to have people who are suffering needlessly. We're going to have this whole thing of people having to learn the same thing over and over again, interfering on a legislative level, on a pharmacological level, because they're like, how much investment are we going to put into this if getting to care is delayed? We're going to have fewer people who are going to even be eligible for those cures, right? When they become available, because they're going to have suffered for so long. Care. And so I think those are all really the points for why it is so important that we all work together. You know, lessons learned. 85% of what we go through as families with rare diseases, that really is shared. Okay, there's some of us that have benefited from newborn screening, and so we can now say, you know, if you have newborn screening for everything, we can limit most of the other journeys, right, for rare diseases. But 85% is getting the medicine, understanding the disease, working around your house, adjusting family things, financial things, access to care, all of that really is the same. That 15% or so is really disease specific. And so if we have working together on this corporate level, right, we can really, I keep saying the same things over and over again, but then we can really accelerate what happens. And because of where we are with the standard, I'm going to say the quality of care right now and the strain on care, we really have to speak out with all voices. And there's the FDA has now come out, right, and they have learned, right, it took them a while to put things together, but they have really learned the value of having a platforms, right, that where they're developing and not developing, where they're helping to evaluate meds differently and do things differently, and building on one treatment to the next in order to accelerate cures. So I think that's really, again, that's really the power. We want the speed, we want the quality, and we need the unity in order to make that happen.
Yeah, absolutely. I mean, I know you're familiar with this statistic, right? But, you know, sickle cell, hemophilia, von Willebrand's disease, cystic fibrosis, they're all rare diseases, right? They affect a relatively small number of people compared to things that you think of like, you know, diabetes or heart disease, right? But 1 in 10 people is impacted by a rare disease. So when you think of all rare disease together, cumulatively, we are a large group of people and we can really make a big impact by working together. And again, like you were just saying, you know, 85% of what we deal with as a rare disease patient is shared across rare disease, right? There might be 15, 20% that is kind of specific to our disorder, or a handful of disorders that we're having to deal with, but so much we can learn from one another, support one another. So I want to move into, you know, we talked a little bit about this, so I'm going to touch on it. I think some of the shared priorities that we have in rare disease have to do with things like we've touched on all of these, right? The diagnostic journey, how difficult it can be to get a diagnosis, emerging therapies, like what we're dealing with gene and cell therapy. And the vast majority of rare diseases have no therapy at all that is approved by the FDA right now. And so many others, as a lot of the emphasis within sort of, you know, the kind of within the industry are working on new therapies. A lot of the emphasis right now is in the rare disease space. And then we have things like, you know, step therapy, copay accumulators, or protecting patient assistance, equity and inclusion issues, and that whole idea of shared decision making. These are all priorities for all of us across rare disease and things that we are tackling through the California Rare Disease Access Coalition. And then, as we've talked about, we expand our base of support by doing that. We learn from one another, and it helps generate more resources, right? Because we pool what we have, we pool the things that we've learned, we pool the financial resources, and it just can make for a more effective strategy going forward. So I want to kind of jump over to this idea of how do we personalize it, right? Because we don't have a ton of time, and I want everyone to be able to go home tonight with some things that maybe they might be able to implement on a more personal level from this idea of collaboration. And I know that Adrienne, you guys have really kind of done some maybe unique things, maybe not, but like I'm sure there are other groups that do it as well. But initiatives to help support families through that medical journey, specifically when people end up in the hospital, right?
Right.
And I know in the bleeding disorders community, we at times have difficulties in those settings as well, right? You show up at the ER, you're bruised, your child is bruised, and they do not think first of hemophilia or von Willebrand's disease. They think first of abuse, you know?
Right. Yeah.
And there are families that get referred to CPS because there's concern, they're thinking, oh, somebody's abusing this child, which they're trying to protect the child, so we get
Right.
that and respect that, but obviously that is a very frustrating experience for the family. Sickle cell patients similarly face various different stigmas and biases when they are trying to seek treatment. Both patient populations can deal with a lot of pain as part of what they're dealing with. And we all know that the more pain that you're in, the more difficult it is to really be an advocate for yourself, right? So what are some strategies that you encourage community members to do, or things that you offer to help people kind of navigate some of those issues?
So I think for us, one of the largest things that we did was we sat back and we looked and we said, what kinds of things are being done, right? More traditional in terms of education and things like that. And to me, where can we help and support families the most? So we created a course for people who are doing access, not doing access, but doing point of care advocacy for themselves, or well, not for themselves, their loved ones, right? Because we feel that if you're sick, you shouldn't have to advocate for yourself. We were thinking, how can we help you save your resources? And so, given that, we've been able to, that approach is novel, but we've been able to have care providers collaborate with us and donate time, software developers, all of that, so that we can build this platform and a course and an app, so that we can provide that support 24/7. And what that does is it frees us up from carrying that burden of that fight 24/7, fight against a system you should not have to be fighting for. So I think, although I sound, in many ways, people will go, well, oh, that's great, you're doing that for other people. I'm not. I'm doing that for me too, because my kid's in the hospital now. I need help. So I think that was it. And also the collaboration with other groups. There are things I am not, I'm really good at, and there are things I'm not good at. And that collaboration helps me connect with and work with groups that are doing things that are really, really great, right? And I get to do the things that I'm good at. And so we're all working together much more efficiently. And so there are groups that do legislative, right, advocacy, great, Chronic Care Coalition, right? I have a group in DC that does policy work on the federal level. So I get in there, I work in there, but I can't carry it. But I know that's important and it's being done. And there's something really to be said about you emotionally. I'm going to say this, and personally, where that there are other people fighting and doing the good fight, right? Because there's a lot of fighting going on. It's not necessarily good fighting. And that you can contribute to that, but you don't have to carry it on your own. There's another group that I'm working with that works on helping getting people access to services. So for a while, we were trying to advocate and do services. Well, you can't, particularly if you don't have the budget. But if you get this group to say, okay, this is what we do, I'm willing to work with you, let's plug it all in and do that. So, and then I also think that currently, you know, this model we have, a lot of us as organizations depending on pharma for funding and things like that, that's really great. But it doesn't really give us a really good path to sustainability. And I think that's the other thing that working together, we can sort of figure out together. Because many of us get started as small groups. And we have a personal journey and reason for it. And I think thinking of ways together on how to really impact our community, the day-to-day lives, is very different than the focus of a pharma company, right? And so together we can come up with ways to help us transition from having a population that's been disabled, a family that's constantly disrupted, to a family that can transition and take advantage of these new treatments and things and move forth from being a place of disruption to being a place where you're self-sustainable. And I think that's all our goals. I mean, what good is a healthy life if you can't work or you have no skills or you know, there are all these things. So so I think together we can do that and really change the rare community.
Yeah, I really love the idea that you kind of touched on, because I think this is so true for us as groups, but also for us as individuals, of like really identifying that like there are certain parts of this that certain parts that I'm good at and certain parts that other people are good at. And it's even true sort of within our families individually when we're
Oh,
facing a
yes.
medical crisis, right? It's like, who's the person that's good at talking with the doctors and the staff?
Right, right,
Well,
right.
free them up to do that. Somebody else can, make sure everyone's fed. Somebody
Yeah,
else might be good at notifying the other family members as to what's going on, right? It takes
that's
all
right.
of us to do those pieces. And that's also where we as a community can help and fill in those gaps, right?
Exactly,
Because not every individual has a family that
exactly.
has enough of a bandwidth to be able to take on those responsibilities, right? Sometimes
Right.
we have to
Yeah,
be one another's families and sort of stand in the gap in those more emergency situations and say like, okay, I'll go sit with that person at the hospital
yeah,
and make
yeah.
sure that they're getting what they need, to be able to be an advocate on their behalf.
Right,
Um,
right. I call that our found family.
yes,
And the other thing it does is people don't really, we always talk about the burden and this, that, and the other, but um, one of the things in working together is we can see other people having our CERM. It gets us away from our own journey and we can find people who, because we're always comparing ourselves to quote unquote normal. And they were always having to explain why I could show up and feeling bad and then all of that kind of stuff. Well, we never do. You know, I just go, oh, my kid's sick in the hospital and everybody's like, oh, okay. And they understand. So I think
yep,
that again, when I talk about it, it 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 is a resource and it allows us individually and as organizations to use our resources in the most efficient way because we don't have to carry everything. We don't have to carry everything.
absolutely. So another piece of that, but while we still have time, is just kind of this idea of shared decision making, which is really like kind of I mean, this is the way it really always should have been, right? But now it's kind of a buzz thing that we're all talking about. But I think it's great, and I think it's something that patients really need to be empowered with. And I love this explanation here. It's jumping down to the second half of it. It says the optimal decision making. So the best kind of decision making in the medical setting is when it takes into account evidence-based information, right? So accurate information
Mhm.
that's based on science and good medical research, evidence-based information about available options. It includes the provider's knowledge and experience and the patient's values and preferences, right? All of
And
those things are taken into account. And it's really critically necessary that that communication be taking place between the patient and the provider in order to get to this shared decision making. We don't have a lot of time left, but do you have any thoughts that you want to add to that?
Well, I was just going to say, in our advocacy course, we spend so much time on that thing, on teaching, right, the right vocabulary, so that we can, and getting people to understand what the providers are going for, and fine tuning our skills, right, so that we can really take, how can I say it? We can really express that piece where you say, using our values and preferences and experiences, right?
Yes.
And where we fit in with what's happening with the medical providers. And I think those lessons, understanding what kind of people are providers, right? And being able to then navigate the negotiation, because it's all about negotiating. So it's really high on negotiation skills in order to get to that optimal place of care. But that's in any given situation. So I think it's what's revolutionary is that we are now taking it into account for our health, where before we just would listen to care providers, and the care providers training hasn't caught up to us yet, but but I think they're moving. Well, we
Yep.
can move that needle.
Absolutely. That's great. So just briefly, some of those partners in that shared decision-making process and in this collaboration, your doctor, your nurses, your social workers, other providers, family, friends, community organizations, right? Are all resources for you to tap into. I'm going to skip over that question just because, I mean, it's the time has flown by. And I want to go ahead and throw out, we do have resources. We want to let folks know that we are here to help them. Feel free, Adrienne, if you also want to, if you're able to throw your information in the chat. I should have put that on the slide as well, but want to just pause there and see if anyone has any questions or comments that they want to make. Before we wrap up for tonight. Really appreciate you joining us, Adrienne. I think this was a good discussion, and I think we could have gone on for, another 2 hours probably. But it was hopefully a good introduction for folks to these topics.
And I just want to say we're going to do a general class or town hall on this point of care advocacy, and so we're just opening it up. We've just finished we're finishing up our last courses for the prototype, and so we'll be ready to launch. So we're going to announce it at the end of next month, and it's free. And so Lynn, you'll be asked to distribute the flyer for it. And
awesome. That sounds like a great resource, and we'll be happy to share that out to folks. Did anyone have a
sorry.
Yeah, go ahead, Lucas.
Yeah, I'm sorry. I just really can't go in before of that because I was doing something with my kids. But I wonder this was you're going to share this meeting for the
Yes.
I'm from Argentina, and I want to listen again, and I just can be before of that.
Yeah, absolutely. So Lucas, Andrea, if you have a second, can you go ahead and put your email in the chat also? We will post it on our YouTube channel, and we do try to do that actually in both English and Spanish. because we do have the translation happening as well. And so we will try to post that, but sometimes it does take us a little bit of time to get the video edited. So if you reach out to Andrea, she just put her email in there, we can maybe get that more raw video sent to you more quickly.
Thanks, Ed. You are very kind. I just want to hear, because I understand you when I when I listen in English, but my English is not so fluid. I don't have any practice here, so I can understand everything you are telling me, but when I have to talk with anyone, I don't know how to speak some words, and we are going to talk about joints and relational, everything. Well, thanks. I'm going to email her. So thanks very much.
Perfect. Well, your English is a lot better than my Spanish.
Exactly.
So.
I was thinking the same thing. And I just want to say I did put my info in the chat, and we're here.
Thanks.
We will advocate for anybody. We do 24/7. If you need help, just give us a call, and we'll plug in.
Absolutely.
Thank you very
Thank you,
much.
guys. So again, just as we wrap up, I want to thank our sponsors again who help make our monthly webinar series possible. And thank all of you for joining us tonight. We are going to take a little bit of a break over the summer. So we'll resume our webinar series in August. And this fall, we'll be doing a lot on, navigating the healthcare system, dealing with insurance, things like that. So we hope that you will come back and join us if you find that those topics valuable and interesting. So thanks again for being here tonight, and feel free to reach out if there's any issues that either Adrienne or I can help you with. Thank you so much.
Thank you. Thank you for having me. Thank you.
Thanks for joining us, and have a good evening, everyone.